Hello, welcome to the next video. This is part 3 of the psychological disorders video. There's a part 1 which talks about an introduction, dissociative identity disorder, and antisocial personality disorder. There's part 2 which talks about anxiety disorders like phobias and PTSD. And this is part 3. We're going to talk about mood disorders such as depression and bipolar disorder. Okay, let's start out with a joke. Why did Pavlov's dogs develop paranoia? Because every time they salivated, Pavlov just smiled and started scribbling in his notebook. Okay, that would drive anybody crazy, right? We're going to get into mood disorders, and before we go here, I just want to say I've been teaching this class for a long time, and I've been sharing that I have bipolar disorder. And the thing that brings me a lot of satisfaction is when former students who have bipolar disorder, maybe when they're 22, 23 years old, they get diagnosed with bipolar disorder. They come back and they call me and we talk about it, and I help them out as much as I can. So that said, going forward, if you or a friend or anybody you care about gets bipolar disorder, I want to put it out there that you can use me as a resource if you ever need any help. I'm more than happy to help out. So what about major depressive disorder? Let's get this slideshow up here. Depression is the common cold of psychological disorders. 5.8% of men in a given year around the world will report depression, and 9.5% of women will report depression. What are the symptoms? The symptoms have to last for 2 weeks or longer. And remember, they have to be those 3 Ds we talked about with the psychological disorders: distressful, dysfunctional, and I'm spacing out on the other one. It'll come back to me. At any rate, it's not just sadness. Depression is not just being sad for a little while. It's not being sad after a funeral. It's not being sad after a bad breakup. Depression is more severe. So here are the signs. Loss of interest, feelings of worthlessness, low energy, and it has to last for 2 weeks or more, and there can't be some good reason for it, such as your mother passed away. Bipolar disorder, on the hand, is going between depression and mania. And so what is mania? Here's the depressive symptoms we just talked about. The manic symptoms are elation, euphoria, drive for action, like a ton of energy, and having a bunch of ideas, jumping from one idea to the next. The bipolar moods could last for a couple months high, couple months low. Could be a week up, couple weeks down, couple weeks up. So the duration of the ups and downs can vary depending on the individual. Also, when it's children, the fluctuations can happen within a single day, up and down, up and down. But when it's adults, it's more like a couple of weeks. There is a link between people having bipolar disorder and being really creative. When you're manic, you have the surge of energy and creativity. So people like Hemingway, Virginia Woolf, Walt Whitman, all had bipolar disorder. We'll mention suicide now. Suicide is the most severe form of behavioral responses to depression and people with bipolar disorder. Approximately 1 million people worldwide commit suicide each year. It's a really serious thing. We should take it very seriously. If our friends are talking about suicide, we should call a counselor right away or tell an adult and get help. We don't want to overlook it if there's something that needs to be done. You'll see here that men commit suicide more often than women. Women actually attempt more, but women tend to attempt suicide with pills and you can be saved, whereas men tend to commit suicide with guns, and it's not as easy to save someone in that situation. There are some gender differences in depression also. Women tend to get depressed more than men, almost twice as much. And people don't know exactly why. Maybe it has something to do with genetics or hormones, or maybe it's that women's lives are more difficult because of they get oppressed more often. They experience more violence from their partners. So no one's sure exactly why. Okay, some facts about depression. A lot of the episodes will terminate after a while. It can be helped. Usually, there are stressful events that precede a depressive episode, and depression diagnoses are increasing, especially in teenagers. So that's a trend we're seeing that's going up. It's not a good trend, but it is happening more anxiety, more depression in teenagers. So why does it happen? Well, the biological perspective says that there's a genetic influence, and they note that in twin studies, the rate of depression is higher in identical twins than fraternal twins. So that tells you there's some genetic component to mood disorder. The biological perspective, we'll talk about the brains, and these PET scans show the brain states of people with bipolar disorder. This first one is on May 17th. On May 18th, it's a manic state. And you can't see this third picture, but it's May 27th, and it looks like this first one again. So someone going from depressed to manic and then back to this again in a span of 10 days. The biopsychosocial perspective, the picture didn't come up. So again, with bipolar disorder, there could be psychological factors, social factors, and biological factors all contributing to the onset of depression and bipolar disorder. The social cognitive perspective has a theory. They suggest that depression arises partly from self-deflating beliefs, self-defeating beliefs, and negative explanations for phenomenon in your life. For instance, let's say you break up with a romantic partner, and you could interpret it as, this is hard to take, but I will get through this, or I'll never get through this. So if you're the type of person that says, I'll never get through this, that type of pattern of thinking might lead to depression. And so you can see this whole column is things that might lead to depression. These would make it less likely that you would get depressed. So depression can be a cycle. Some stressful life event, you explain it in this negative way, you get a depressed mood, then you change your behaviors, and the stress gets harder to deal with, and it just becomes a cycle. Okay, we're going to switch gears from mood disorders to schizophrenia. Schizophrenia is a very serious psychological disorder. Both mood disorders, bipolar disorder and depression, you can treat and you can go on with your life. You can get therapy, you can take medication, and you can learn to live your life. Schizophrenia is a little more debilitating. Some people with mild schizophrenia can treat it and go on living. A lot of people with more severe schizophrenia would maybe live in institutions their whole life. So what is it characterized by? Disorganized and delusional thinking, disturbed perceptions, that's thoughts, and inappropriate emotions and actions. Schizophrenia happens in about 1 out of 100 people worldwide. So it's not like dissociative identity disorder where I said it happens mostly in the United States. Schizophrenia is 1% of the population everywhere in the world, about 24 million people. It tends to strike people when they're young adults. Early 20s is common, where you would not have any signs of schizophrenia before that, and then you would have signs after that. So with schizophrenia, you can break the symptoms into positive and negative symptoms. Positive is when things are added, like there's more hallucinations, more disorganized thinking, and more delusional talking. Or negative symptoms, which is the absence of appropriate behaviors like a flat affect, no expressions, rigid bodies, not normal movement. So with schizophrenia, you might have hallucinations. You might hear things that are not there or see things that are not there. Usually the hallucinations are hearing things. You might have a flat affect, which is showing no emotion at all to really good news or bad news. You might have catatonia, which is rubbing an arm, rocking in a chair, or being completely, or catatonia is completely motionless for hours, just sitting completely motionless. So that's what schizophrenia is. What are some thoughts on why it happens? One thought is that there's dopamine, too much dopamine going on in the brain. So the higher levels of that neurotransmitter causes some of these symptoms. Brain scans also show abnormal activity in the frontal cortex, the thalamus, and the amygdala. And also, there's been research on fetuses. If the mom gets a viral infection in the middle of being pregnant, then you have a higher likelihood of developing schizophrenia. So there's some different theories out there about what it is exactly. And we're not sure, but we do know that 1% of the worldwide population has schizophrenia. Oh, last thing is that there are some genetic factors. Again, identical twin studies. If your identical twin has it, there's a 50% chance you will have it. And you can see if it's both parents have it, there's like a 48% chance. One twin, one parent, one sibling, unrelated, it's down to 1%. Okay, that's it for mood disorders and schizophrenia, and that is it for part 3 of our psychological disorders video. I hope you are able to absorb some of this and remember it for the AP test. If you have any questions, you can see me in class.